Hello, we're going to talk a little bit about how to work the oxygen machine. The best place for a resource is right on top. There is instructions on how to calibrate it, how to use it in general, how to change the settings, and this really is the best place to go, other than this video of course, to figure out how to set up the oxygen machine. So the first thing we're going to do is make sure that the oxygen on the flow meter, which is over in the corner, is off while we do all the calibrating. So now I'm going to open the doors when we calibrate, just to make sure that if there's any oxygen in the cage, we let it out. I'm going to turn on the machine. All of our fancy lights are on now. I'm just going to keep these open for a second, let any oxygen that's in there drain out. Another thing when we're setting up the machine is to make sure all of the ports are closed. So there's a red cap that covers a port right here. There's one on the other side, and there's one right here. We want to make sure those caps are on, otherwise the oxygen will leak out of those holes, and we won't be getting as much oxygen to our patient. So to calibrate the machine, now I'm going to turn the oxygen on. I'm going to turn the little dial so that the ball is up to the 15 at the top now. I'm going to press this calibrate button. I have to hold it down for some time until there's like a blinking that happens. It might be 10-12 seconds. So everything kind of blinked a little bit. So the machine is going to calibrate. And this number here, 20.5, is going to go up to 33 during the calibration. So now we just have to wait, and it'll be fully calibrated when it's up to 33. Stop it. All right, another thing we want to do when we're setting up the machine is to check the soda lime and the drip tray. So those are both in this chamber here. And to open this, you have to pop this guy up and that one, and they kind of turn. So you can pull it out. If you see like it turns and releases that's holding it on. I'm just going to put this here. So the soda lime is here, and we want to change this every time we are putting a patient in there. You can see that it's a little bit purple. That means that it is spent. So this is meant to absorb CO2 so our patients aren't rebreathing CO2. So when it's purple, it can't be used anymore. We want it to be white. So I'm changing it anyway. I'm just going to dump it in the garbage, all of it. And the best way is maybe to just put this right over the garbage so you don't make a mess. There's more soda lime up here. It may also be under the sink here in the clinic or under the counter. You can check those cabinets. Otherwise, you need to get more from the locked room and x-ray upstairs. It out, put that back in, and under here is a little tray that collects condensation. So if there's any liquid in here, you just want to take it over to the sink and dump it out and place it back right here. And then to put this back on, just kind of angle it in like that, and then I turn it. Can't get it to turn, but anyway, you would lock it down like that, and it's closed.
All right, now you can see that our machine is fully calibrated now that we are up to at least 33%. And the high level of percent oxygen and the low level will always be 2% apart. So if the high is 33, the low will be 31. And I can check that by just hitting the down arrow. It tells me that it's 31. And then it'll take a minute, and then it'll go back to showing me the current level of oxygen. So sometimes when we have patients in oxygen and they're getting better and we want to slowly wean their oxygen back down to normal air, which is 21% oxygen, we will lower their oxygen percentage by 2% every couple hours per the doctor. And to do that, I will change the setting with this set point here. So the upper level is 33. I'm going to hit this up button that shows me 33, and I'm going to lower it. I'm going to hold this down until it gets down to 31, and I'm going to let go, and then it is going to flash back. Now it's going to tell me that that's what our current level of oxygen is. Now, if I hit this low button, it'll tell me 29 because the high level is slowly coming down to 31. So that is how you would decrease the percentage of oxygen. Some other settings here, you can change the temperature of the floor in the cage. Just be careful to always be checking it to make sure it's not too hot. You can change it by turning it on here and changing the temperature just like you do up here. The set points will be 2% or 2 degrees apart on the high and the low, but I'm going to keep that off. I'm going to keep this one off too. This is the temperature of the whole unit. We just want to make sure that that is roughly around 72. If it gets too warm in there, we want to adjust that. Climate control should be generally what we keep it at. Probably unlikely, but if we were to ever have 2 patients that needed to be in oxygen, behind the unit are these divider walls, and you can lift that up and slide it in that groove at the top, and it fits in the groove in the back. And also, if your patient is on IV fluids, we'll generally hang the fluids from that hook up there, and there is holes in the ceiling that you can drape the fluid line through. So you'd want to get your fluid line through there first, obviously, and then you would hook it up to your patient. Okay, pretending that our patient is all done in the oxygen cage, really we can just come on over here and turn it off. We can also turn the flow meter all the way off. The ball's already down because the machine's off, but this is off, ready to be off for the calibration for next time. Always be sure to clean your cage, but otherwise you really just need to turn it off and it's all set.